dito yung mga possible ghost members, patients, because this happens or in a big organization, especially in government, with my colleagues, doon po sa housing, may mga ghost borrowers, di ba? So, ghost beneficiaries. So, it's not remote that here in Philhealth, dahil it's a very generous ho ang Philhealth, no? Maganda ho ang napakabait ng Philhealth, very generous. We want to help everybody. Kaya lang, there have been reports that there may be ghost members or ghost patients. No? May mga nagte-take advantage talaga. And that's what we really want to plug. And to stop the hemorrhage. Siguro hindi na ito sa level sa taas, but it happens below. So that's what we want to find out. Yes, Congresswoman Dan.
Balikan ko lang po yung na-mention kanina ni President de la Serna tsaka ni Dr. Jimenez on the joint statement. I'd like to know kung ano ang timeline nyo po, target ninyo na na-reconcile yung mga unpaid claims.
Thank you very much. Mr. Chair, can I answer?
Ma'am, go ahead.
Thank you. Dun sa agreement namin with Dr. Jimenez, we will be doing every Friday reconciliation until we finish all the complaining hospitals. However long it would take, we will do it every Friday. Either dun banda sa kanila, kung malayo kasi yung office natin sa Pasig. But we will continue to do this.
Personally, kayo po ang nag-handle or the regional offices can handle it?
Now it's the central office that's handling it. Yes. In fact, the process is, it should be the regional offices. But again, para mapabilis at ma-ensure na gagawin, central office will be handling it. Of course, with our CO.
Yeah, I think it would be better. I visited Philhealth region, in my region. And they showed me yung mga process for my appreciation lang, no? Pinakita nila din naman na yung tama naman sinasabi nila din na yung kiniklaim minsan ng hospital na unpaid claim, may mga reasons behind. So nakita ko may mga return to hospital, on process ang appeal. So but ang tinitingnan minsan ng hospital owner is that as a whole, itong amount ninyo na babayadan. Pero pag tiningnan mo talaga yung data na reconcile, naman, makikita mo na may nami-miss din the management of the hospitals na hindi reported actually ng kanilang mga managers in the hospital. So, we want it, ako personally, sana the regional offices can handle it talaga para to fast track din. And then I think that's the most accessible for the facilities, no, and professionals. But of course, with your monitoring if the regional offices are doing it. Dr. Jimenez,
Ginawa po na, Mr. Chairman, ginawa po namin yung sa main office kasi nandun po lahat ng records. And then of course, sinabi ko po sa kanya, maraming data na hindi niya alam na hindi nire-report ng Vice Presidents. Yung nalaman niya from me, ay hindi po niya nalaman before. So, yung po ang problema sometimes.
Well, that's another problem siguro, no? But at least nire-reconcile nyo na po yung mga data. Yun pong target nyo doon sa mga denied claims on process. Yun sa process nyo po. Kasi ang tagal na mention po nila. I was given by NKTI at data. Meron silang filed denied claims, naka-appeal po sa inyo 2 to 3 years na. And that's huge amount. Yung supposed to be na process po ninyo. So, gaano katagal na po ngayon ang target natin?
Madam Chair, Your Honors, actually what we have done as regards even prior to this issue is we have actually right now, binigay na po namin sa lahat ng ospital electronically lahat ng status ng kanilang claims. This applies not only for private facilities but for everyone. Binigay namin yung status ng claims nila from 2014 to 2018 so that they would be able to see yung claims nila na nabayaran na ng Philhealth, those that are still in process, denied, and RTH. Apart from that, within the next 2 weeks, our Philhealth would be launching the portal wherein makikita na nila on an individual basis, claim. Pag tinype nila yung pangalan doon, makikita na nila yung status ng claims. this is apart from the reconciliation that we have also directed our regional offices to conduct with the facilities. Last week po, our regional office in NCR did some validation from some of the hospitals named by the group of Dr. Jimenez. We were able to validate that many of these claims have already been paid by Philhealth. So reconciliation is ongoing, Your Honors.
Mr. Chair, I'd like to take this opportunity also to bring up this matter on the Philhealth Circular 2018-007, no, on the implementation of the CF4, no? Kasi I think on June 1, this will take effect. So, I have a discussion on this doon po locally sa amin. Unfortunately, hindi po siya cascaded talaga sa mga professionals, sa mga doctors. Kasi doctors po ang mag-a-accomplish nito pag-file, before ma-file ang claim ng isang case. So, gusto ko lang pong marinig from Philhealth. First, why a sudden change considering kaka-implement pa lang po natin ng e-claims wherein ang ginagawa po na hospital has to scan all the charts on 4 cases and then nahihirapan sila. Pero ito po kasi from the end of the professionals, of the doctors. So they need to fill this up again, parang duplication po ng process. Ang apila ko lang po talaga pag-aralan kasi again may effect na naman po ito sa delays on payment kasi definitely madidelay po ang filing nila kasi until ma-accomplish ng doctor ito, hindi makakapag-file ang isang facility. Parang 2 days na lang, this will take effect. So, press and the PHA and PMA, please, baka pwede natin itong pag-discuss briefly.
Thank you very
For your
much.
information, ma'am, hindi po yan na-relay sa amin. In fact, sinabi lang ng mga hospitals na, please, Dr. Jimenez, do something about this kasi June 1st na yung ano. So most hospitals do not know yet about this CF4.
Now,
Yes,
Madam
Pres,
Chair,
yes
can
po,
I
if
just
you can
answer
explain.
again? Yes. Because of the clamor of the hospitals, of the tedious photocopying or scanning of the charts of the patient, dahil maraming pages nga siya, we devised this CF4 to make it easier para isang page na lang siya. And all the data that we need to support the claim of the hospital would be there. Kaya po ginawa yung CF4. Thank you.
Press, for consideration lang po, kasi I'm also a doctor, no? At obserbahan ko na po kung gaano kahirap po talaga magpa-sign, magpa-accomplish ng mga forms sa mga doctors. So, currently, sa hospital, no, sa facility, mas okay na sa kanila yung in-scan and then they submit it to you. Kasi nga, yung problem, that's another layer kasi eh. Kasi nag-fill up na ang doctor, nag-order na siya doon sa charts, and then again, sasabihin mo sa kanya, you need to summarize everything you did or all the services you've given to the patient, and then that's the time pa lang naman the staff can process. Yun lang ang nakikita kong gap. I don't know kung paano natin i-simplify yung chart. Pwede bang, hindi naman pwede, diba? For audit purposes. Yun lang, ang apela ko lang po talaga is not to implement it effectively on June 1 kasi nga everyone is not ready. Yeah, consultation sir.
Thank you very much po. May I turn you to one of our board of directors, the chairperson of the benefits committee.
Yeah, I'm Dr. Roy Ferrero from the employer sector and the chair of the benefits committee. We studied this process and actually this is the request of the hospital owners because of the bulk of submissions of charts. You know, you have to submit all the charts and the lab tests and it will take a lot of Xerox copying. Now with regards to clinical summary, clinician rin po ako. Ginagawa na po ito dati ng hospital natin. Yun lang, pinaganda lang po yung C4. Para po sa isang page, makikita natin yung necessary data and information to validate the claims. Kasi yung nga po ang ating isang problema, marami pong bleeders at fraud claims. So ito yung upcasing and all these things. So with all this C4, it will make it easier for the hospitals to do it and to submit it attached to e-claims.
I have nothing against it. It's a matter of yung pag-execute nyo po ng
Yes,
circular
1 month.
kasi hindi ready lahat. I don't know kung sino pong sinasabi nyo na hospitals, but majority of the hospitals naman doon sa probinsya, sinasabi nila, ayaw naman nila nito. So, baka hindi po unified yung...
Your Honor, yes, we had this on our meeting, and we will give 1 month po extension for that, to give the information.
Supposedly, that is why it is very important to have a very close coordination between Philhealth and hospitals. Because sometimes you want to implement new policy statement or direction, which is not really appropriate, for example, which is impossible for us to comply. Now, if in this case, another layer in bureaucracy, which is contrary to the recently signed law, and that is doing business in government. So, maybe, is it not possible, for example, like we've been having a lot of regional conferences, and these were never actually being discussed. So, meaning you just come out with, okay, these are our policies because you feel that this is important. We do agree that maybe it will help in solving the issue, but is it not possible also that prior to implementing or crafting it, is it possible, for example, that we can sit down and then we can really come out with a better consensus and a better consultation from other stakeholders? Because sometimes, let us say, if hospitals only coming from a certain part in the Philippines, which not be reflective of the entire sentiment of the hospitals.
We agree on that, sir, with regards to that request for consultation, particularly on your part and with us, Philhealth. And with doing this, I think it will be better for both the Philhealth and the healthcare providers.
Thank you, Dr. Ferrer. Yes, Press, Rapsam.
Madam Chair, I was just going to say that we have had meetings with the PHA as well as PMA in the past, and we have agreed in one of those meetings that we were asking to be invited with the regional meetings. However, the most recent meetings they had, we were not able to attend. But this attendance to their regional conferences, we have already asked to be invited.
Dr. Liacho.
Thank you.
Madam Chair, I suggest and I will move in our board meeting to, aside from the effort being done by our interim CEO, to have a monthly meeting with the group of Dr. Jimenez and Dr. Hardin and Dr. Castro, so that we can iron this out. And then as we move forward, this can be a quarterly meeting so that we can anticipate problems. And of course, through collaboration, we can actually provide solutions. Kasi hindi lang ho ang problema sa amin, may problema din sa healthcare providers. But at the end of the day, kailangan ho masusi ho yung maganda ho aming ugnayan eh. So, we will move for that particular meeting ho, on a regular basis.
Madam Chair. Madam Chair, may I suggest that huwag muna implement by June 1st this CF4. Deferred na lang siguro in the next 4 months para mapag-aralang mabuti.
Madam Chair, if we can allow that, it's a chart that is submitted on all cases. So, mas tedious yun at mas marami yung ipapas. I think 1 month's time para mas simpler ho ang submission ng data. 1 sheet lang po yun. Actually, ginagawa na po yan sa hospital. But then, nilagay lang po natin na in a maganda, in a nicer way para yung data na kailangan nakalagay po sa 1 page. So, in 4 months' time, it will be a deterrent sa hospital care providers to submit all these charts sa Philhealth po. Sa aming side rin po, mas nakakapagod din po yun kasi kailangan mo talaga namin ng legwork to check all these data. Ang dami ko yan, 1 chart. No? Paano kung chronic cases? eh ang kapal-kapal na isa-submit at isi-xerox. And yan ang kulang po namin yung legwork rin po na para magtulong po sa amin to check this validation of claims.
Okay, thank you, Dr. Ferrer. So, we're expecting po siguro na mag-usap po kayo, all concerned organizations with Philhealth, also with the Department of Health, no? Para po maayos yung sistema natin. Do you still have questions on...
Madam Chair.
Yes,
May we request that the issue of the employees will be taken up in the next hearing or the next meeting, because yes, there's an intra-union dispute in Philhealth, but the moment management dipped into her hands into the intra-union dispute, this makes it the concern of the Civil Service Commission, the concern of the DOLE BLR, and the concern of this committee. So we're requesting that the issue of the employees will be taken up next meeting, ma'am.
Yeah, actually, our chair mentioned earlier that you will be given time and opportunity, but we've read your issues and concern. I think we also need other committees, maybe, on this hearing. No? Like you're mentioning on the labor, you're mentioning on the civil service. So it might be better if everyone should be on board for the discussion of the issues. Plus, I think dun po sa inyo, that's an internal problem within the organization. The oversight can always take a look on that. But I guess there's a venue also within the Philhealth where you can discuss these things and thresh out. May mga negosasyon po kayo at pag-uusap. I hope the President, along with other managers, Secretary Duque, your chairman of the board, although doon po kayo sa board, but at least siguro po magkaroon lang. I think it's more of a communication between the concerned individuals.
Excuse me, Madam Chair. I think you have a grievance committee, di ba? You should exhaust all remedies first because we are a legislative committee. We are here in aid of legislation. So if you have grievances within the department, you should settle it within the department. And if you cannot settle it there, then you go to a higher administrative board.
Sir, our concern now boils down on the competence of the President of Philhealth.
Well, that is based on grievances by employees. Is that correct?
Yes, sir. And concern of the program, of the National Health Insurance Program.
Yeah, then that will be a matter for management to take up in the board of PhilHealth, as well as the grievance committee. I'm sure you have a grievance committee among your board, di ba? So, bring it there first, and then if you don't find satisfaction, you can appeal to a higher authority. But we cannot do, I'll be frank with you, I'm a lawyer. No? What can we do here? We will investigate, we will fan the flames. We're not here to fan the flames. We are here to look for legislation. As I pointed out, there are already some proposals here. Yan is better handled by the level of the Department of Health. The chairman of the Department of Health, chairman is the Secretary of Health, and it can be handled by the Grievance Committee of PhilHealth, and then it can move onwards. Your chairman is for former Civil Service Commission, so he knows what he's doing. He doesn't take commissions. He chairs the civil service. So, I think you have a very, very expert chairman here that you can go to. But if you go here, baka mawalan kayo lalo kayo masaktan dahil this is a legislative inquiry. No, I'm sorry. I just have to be very frank and candid. All right. Right now, we're late, sir. And I may be excused. Otherwise, I'll mark us absent.
Okay, thank you.
Mr. Chair, if I may read lang po the oversight provision, the power po ng oversight committee. There is hereby created a joint congressional oversight committee to conduct a regular review on NHIP, which shall entail a systematic evaluation of the program's performance, impact, or accomplishment with respect to its objectives and goals. So, yun po yung reason bakit pinrioritize lang po namin yung factors that affects the operation. In spirit po of fairness, kasi may another group of employees, brief lang po, statement from you kasi nirecognize namin yung white. We'd like to recognize PISEA. One brief statement po.
Ma'am, please, yung PISEA.
Yes.
Siguro we'll give both of you sa next na lang kasi pasensya na. It's time already. Wala lang. Pasensya na, inabot kami kasi 2 o'clock, dapat supposedly 3 o'clock eh. But since it's our last day, today and tomorrow, last day, so we'll give you both and then we'll give also Dr. De La Serna the chance also to answer those allegations. Okay? So, again, before we end, that the financial hemorrhage that Philhealth is facing right now is a little bit disturbing. Base po sa inyo pinakita, mukha pong walang future Philhealth in terms of depletion of its funds if we do not do anything. Wag naman sana ayusin po natin because this would Philhealth will be the prime agency that is tasked to implement the universal healthcare program. Calling this oversight meeting is like opening a Pandora's box. Nagsimula lang po tayo sa kamusta na performance ng Philhealth.
At yan po ang naging pagdinig ng Joint Congressional Oversight Committee kaugnay sa iba't ibang issue sa PhilHealth. Isa po sa tinalakay dito yung issue ng ghost beneficiaries ng PhilHealth at ang delay sa pagbabayad ng claims sa mga ospital. Pero tiniyak po ng PhilHealth na sineseryoso ng ahensya ang mga alegasyon ng katiwalian at sinabi po ni PhilHealth OIC Dr. Celestina Maria Jude de la Serna na wala daw silang sasantuhin sa laban kontra katiwalian. Wala rin daw miyembro ng PhilHealth ang tatanggalan ng serbisyo sa mga pribadong ospital. Samantala, ay ipresenta rin po kanina at tinalakay financial status ng PhilHealth. Pero aminado po ang PhilHealth na kailangan daw nilang palakasin ang kanilang monitoring at humanap pa ng mga paraan para sa pagpoproseso ng PhilHealth claims. Mahalaga rin daw ang sharing sa iba pang ahensya ng mga data o mga datos para malaman kung gaano daw kalawak ang katiwalian. Meron din hong nabanggit na meron daw pong 10.6 billion pesos na funds na para dapat sa senior citizen beneficiaries ng PhilHealth ay nasingil daw po noon ni Secretary Garin and former PhilHealth President Padilla from DBM at ngayon po ay inaalam at inaasahan po ng PhilHealth admin na may na-expect pa silang payment na 10 billion mula po sa DBM. Pero ayon po sa DBM ay bayad na daw po ito at ito po ngayon ang inaalam kung nasan po ang naturang pondo.